Download this code from codegive.com, link in the description below. Don't make these 4 common mistakes when applying to NHS jobs, a detailed guide. Applying for a job within the National Health Service, NHS, can be a daunting process. The sheer volume of applications, the specific requirements, and the emphasis on demonstrating values make it crucial to avoid common pitfalls. This guide will detail 4 frequent mistakes candidates make and provide strategies, examples, and even code snippets to help you stand out. Mistake 1: not tailoring your application to the specific role and trust. This is arguably the biggest mistake. Treating your application as a generic template is a guaranteed route to rejection. NHS employers aren't just looking for someone with the right qualifications, they're seeking individuals who understand the specific needs of the role, the challenges faced by the trust, and how they can contribute uniquely. Why it's a problem asterisk. Lack of relevance generic applications fail to highlight how your skills and experience directly address the job description and person specification. Demonstration of understanding it shows you haven't bothered to research the trust or the specific needs of the department, suggesting a lack of genuine interest. Missing the why. Why do you specifically want to work in this role at this trust? This crucial question goes unanswered. How to avoid it. 1. Thorough job description analysis. Deconstruct the job description and person specification. Identify key responsibilities, required skills, and essential experience. Create a table mapping your qualifications and experiences to each requirement. Example. Requirement from job description: your qualifications/experience specific example and result. Provide direct patient care. Registered nurse administered medications to 15 patients per shift, ensuring accurate dosage and documentation, leading to a 99% medication error-free rate. Experience with electronic health records, AIR, proficient with Epic. Trained 5 new nurses on Epic AIR system, improving team efficiency by 15%. Knowledge of safeguarding principles. Completed safeguarding training. Identified and reported a potential safeguarding concern, leading to a successful intervention by the safeguarding team. 2. Research the NHS Trust. Go beyond the superficial information on the Trust's website. Read the Trust's annual report. Understand their priorities, performance metrics, and areas for improvement. This will provide context for your application. Explore their website. Focus on the specific department or service the role is within. Understand their goals, initiatives, and any recent news or publications. Check NHS Improvement/Care Quality Commission, CQC, reports. These reports highlight areas of strength and areas needing improvement, offering valuable insights. Use social media. Follow the Trust on Twitter, LinkedIn, or Facebook to gain insights into their culture, values, and recent activities. 3. Integrate your research. Weave your research findings into your application. Don't just state facts, explain how your understanding informs your approach to the role. Example, cover letter. I am particularly drawn to Trust Name's commitment to specific initiative mentioned in their annual report, example improving patient flow. My experience in relevant experience has equipped me with the skills to contribute effectively to this effort. For example, in my previous role at previous employer, I implemented a new process/system that reduced patient wait times by quantifiable result. I believe this experience would be directly transferable to role applied for and would enable me to support the Trust in achieving its goal of specific goal. 4. Tailor your personal statement. This is your opportunity to showcase your personality and passion. Connect your motivations to the Trust's values and goals. Avoid generic statements like "I'm a team player." Provide specific examples that demonstrate your teamwork abilities within a healthcare context. Example, personal statement. My motivation for applying to role at Trust Name stems from a deep-seated desire to provide compassionate and effective care to patients within a values-driven organization. I am particularly impressed by Trust Name's commitment to specific value, example patient-centered care, as evidenced by specific program or initiative. In my previous role, I consistently prioritized patient needs by specific example demonstrating patient-centered approach. For instance, I describe a situation where you went above and beyond to support a patient, which resulted in positive outcome for the patient. Mistake 2, failing to provide sufficient evidence in your application. NHS applications are competency-based. You need to demonstrate that you possess the skills, knowledge, and experience outlined in the person's specification. Simply stating that you have a skill is not enough, you must provide concrete examples to support your claims. Why it's a problem asterisk. Asterisk lack of credibility asterisk without evidence, your claims are unsubstantiated and appear superficial. Asterisk difficulty assessing suitability asterisk recruiters rely on your examples to assess your ability to perform the role effectively. Asterisk missed opportunity asterisk you're not showcasing your accomplishments and the impact you've made in previous roles. How to avoid it asterisk. 1. Use the STAR method, or equivalent the STAR method, situation, task, action, result, is a structured approach to providing evidence-based answers. Asterisk situation asterisk describe the context of the situation. Where were you? What was the challenge or opportunity? Asterisk task asterisk explain your role and responsibilities in that situation. What were you expected to do? Asterisk action asterisk detail the specific actions you took. Be precise and use action verbs. Asterisk result asterisk highlight the outcome of your actions. What did you achieve? Quantify your results whenever possible. Example, using STAR for problem solving. Asterisk situation asterisk while working as a junior doctor in the emergency department, we experienced a sudden surge in patients due to a local festival, leading to significant delays in patient assessment. Asterisk task asterisk my role was to triage patients efficiently and ensure that the most urgent cases were prioritized, while also managing the expectations of those waiting. Asterisk action asterisk I immediately reviewed the existing triage protocol and, recognizing its limitations in this scenario, proposed a modification to the senior consultant. This involved implementing a rapid assessment station staffed by experienced nurses to quickly identify and prioritize high-risk patients. I then communicated these changes clearly to the nursing staff and ensured they had the resources they needed. Asterisk result asterisk this modification resulted in a 20% reduction in waiting times for high-risk patients and improved the overall flow of patients through the department. The senior consultant commended my initiative and problem-solving skills in a challenging situation. 2. Quantify your achievements asterisk wherever possible, use numbers and data to demonstrate the impact of your actions. Asterisk instead of, improved patient satisfaction. Asterisk use, improved patient satisfaction scores by 15% based on post-discharge surveys. Asterisk instead of, reduced costs. Asterisk use, reduced medication wastage by 25% by implementing a new stock control system. 3. Focus on relevant examples asterisk choose examples that directly relate to the requirements of the job description and person specification. Don't include irrelevant information, even if it's impressive. 4. Be specific and concise asterisk avoid vague or general statements. Provide enough detail to paint a clear picture of the situation, your actions, and the results you achieved. Mistake 3, ignoring the NHS values and behaviors framework. The NHS is deeply committed to its core values and behaviors. Demonstrating an understanding of these values and showing how you embody them is crucial for success. Why it's a problem asterisk. Asterisk cultural fit asterisk NHS employers want to hire individuals who align with their organizational culture and values. Asterisk commitment to service asterisk demonstrating NHS values shows your genuine commitment to providing high-quality patient care. Asterisk discrimination asterisk failure to demonstrate alignment with the values can imply you may not respect patient rights, confidentiality, or diversity. The NHS values asterisk. The 6 core NHS values are: 1. Working together for patients asterisk putting patients first and collaborating effectively with colleagues. 2. Respect and dignity asterisk treating everyone with respect, compassion, and understanding. 3. Commitment to quality of care asterisk striving for excellence and continuous improvement in patient care. 4. Compassion asterisk demonstrating empathy and providing care with kindness and sensitivity. 5. Improving lives asterisk making a positive difference to the health and well-being of patients and communities. 6. Everyone counts asterisk valuing diversity and ensuring fair and equitable access to health care. How to avoid it asterisk. 1. Understand the NHS values framework asterisk familiarize yourself with the specific behaviors associated with each value. You can find detailed information on the NHS employer's website and individual NHS trust websites. 2. Identify relevant experiences asterisk reflect on your past experiences and identify situations where you demonstrated these values. 3. Incorporate values into your personal statement and application answers asterisk weave examples illustrating how you embody the NHS values into your personal statement and responses to competency-based questions. Use the STAR method to structure your answers and provide concrete evidence. Example: demonstrating compassion. Asterisk situation asterisk during a particularly busy shift in the intensive care unit, a patient's family was visibly distressed about their loved one's deteriorating condition. Asterisk task asterisk my responsibility was to provide support and information to the family while also continuing to deliver critical care to the patient. Asterisk action asterisk I took the time to sit down with the family, actively listen to their concerns, and explain the patient's condition in clear and compassionate language. I also facilitated a conversation between the family and the consultant to answer their more complex medical questions. I offered them refreshments and ensured they had a comfortable space to wait. Asterisk result asterisk the family expressed their gratitude for the support and understanding I provided during a difficult time. They felt reassured that their loved one was receiving the best possible care. This experience reinforced the importance of compassion in my approach to patient care. 4. Use keywords asterisk use keywords related to the NHS values throughout your application. This will help your application be noticed by applicant tracking systems, ATS, and demonstrate your understanding of the NHS ethos. Examples include patient-centered, teamwork, collaboration, respectful, compassionate, evidence-based, quality improvement, safeguarding, equality and diversity. Mistake 4, poor presentation and attention to detail. Even if you have the necessary skills and experience, a poorly presented application can be a major turn-off. Errors in grammar, spelling, and formatting can create a negative impression and suggest a lack of attention to detail. Why it's a problem asterisk. Asterisk lack of professionalism asterisk poor presentation conveys a lack of professionalism and care. Asterisk credibility asterisk errors can undermine the credibility of your claims and suggest a lack of attention to detail. Asterisk competitiveness asterisk in a competitive job market, even minor errors can be enough to disqualify you. How to avoid it asterisk. 1. Proofread carefully *, thoroughly proofread your application multiple times before submitting it. Pay attention to grammar, spelling, punctuation, and sentence structure. Use grammar checking tools, like Grammarly, but don't rely solely on them. 2. Ask someone else to review *, get a fresh pair of eyes to review your application. Ask a friend, family member, or career advisor to proofread it and provide feedback. 3. Pay attention to formatting *, ensure your application is well formatted and easy to read. Use clear and concise language, break up long paragraphs, and use bullet points or numbered lists to highlight key information. 4. Follow instructions carefully *, adhere to all instructions provided in the job description and application form. Pay attention to word limits, font size, and any specific formatting requirements. 5. Check contact information *, double check that your contact information, phone number, email address, is accurate and up to date. 6. Use a professional email address *, avoid using unprofessional or inappropriate email addresses. 7. Document format *, always submit your CV and cover letter as PDF files unless the job posting specifies otherwise. This ensures the formatting remains consistent regardless of the recipient's software. Code example, illustrative, ensuring consistency in text formatting. While you won't directly submit code in your NHS application, unless you're applying for an IT role, this Python example demonstrates the principle of ensuring consistency in formatting, which is crucial for your application. Explanation of the code example, as an analogy. The format _text function represents the meticulous care you should take in ensuring consistency in your writing style, grammar, and tone throughout your application. Just as the code cleans up inconsistent spacing and capitalization, you must refine your language to present a polished and professional image. The check_values function is symbolic of a recruiter checking for key NHS values: compassion, improving lives, respect, quality of care. It checks whether the applicant addresses those key values. Key takeaways *. Tailoring is paramount. *. Customize your application to each role and trust. * Provide evidence. * Use the STAR method to showcase your accomplishments. * Embrace NHS values. * Demonstrate your alignment with the organization's ethos. * Pay attention to detail. * Ensure your application is error-free and well presented. By avoiding these common mistakes and following the advice in this guide, you'll significantly increase your chances of success in your NHS job application. Good luck! Remember to research, reflect, and refine your application to demonstrate your suitability and passion for working within the NHS.